Hello, thank you for tuning into the program today. I'm your host, Neal Howard, here on this Health Suppliers segment on Health Professional Radio. Our guest is Paul Gionfriddo. He's president and CEO of Mental Health America, and he's joined us here to discuss the crucial need for increased awareness and dialogue among patients, caregivers, and healthcare providers about the emotional and communication needs of patients suffering from schizophrenia. Hello, and welcome to the program, Mr. Gionfriddo.
Thanks for having me on.
Glad that you could join us today. For any of us who may not be as familiar with schizophrenia as we think we are, explain this condition to our listeners.
Well, people with schizophrenia often hear voices or have visual hallucinations. They may have difficulty sleeping. They may have trouble with attention. They may have difficulty staying in school when they're young, holding a job when they're older, and basically following the rules of society in the way that we would expect them because of all of what's going on in their brains.
So obviously this affects patients and their families in a negative way. What do you think are, the greatest challenges or unmet needs when it comes to treating schizophrenia?
I think the greatest challenge related to treating schizophrenia is that too many people confuse schizophrenia and its psychosis with violent ideation and think that somebody with schizophrenia has the potential to become violent at a moment's notice, and therefore, because of this myth, people are afraid to reach out and engage people who are living with schizophrenia. And I think the greatest treatment need that we've got is for people to understand that schizophrenia, like other mental health conditions, has stages, and that if we wait till we get to stage 4, that we're going to reduce the probability of recovery. But if we act before stage 4, like with every other chronic disease, then we have great potential for identifying schizophrenia early in the process, working with people before their families have fallen apart, before their work has fallen apart, school has fallen apart, and frankly, before their lives have fallen apart. So waiting too long is the problem we've got right now, and being afraid of doing early identification and early intervention around schizophrenia and psychosis is the problem.
Mental Health America, you're president and CEO of this organization. Is this an organization that's involved in awareness, or do you have a staff of psychologists and other healthcare providers there? Talk about Mental Health America's role in the changing landscape of schizophrenia treatment.
Mental Health America is a 108-year-old organization that was founded by a person with lived experience, a person with a serious mental illness, Clifford Beers, who created this as an advocacy organization with public awareness being part of this. He really is the father of all modern mental health advocacy in America and really across the world at this stage. We focus on prevention, on early identification and intervention for those who need it, on integration of health and behavioral health and other services with recovery as the goal. And we have a number of people and skill sets who work for our organization and who work among the 200 plus affiliates and associates that we have around the country. Some of them are clinical folks. Some of them, like me, are lay people. And but all of us, I think, share this common mission that we need to do earlier identification and intervention if we're to promote recovery. Our most popular webpage on our site is, in fact, our schizophrenia webpage, which provides a lot of information for people about the condition and really points them in directions that they can go to provide care, services, and supports.
Some of the treatment options that many of our listeners may not be aware of, one of them, I believe, is a 2-month, some type of Aristrata.
There are a number of treatment options. Basically, up till recently, most of the treatment options that included talk therapy and forms of talk therapy, in addition to drugs that were taken in pill form that you had to take every single day, which is not the most practical thing for somebody, for example, coming out of jail or who is homeless and unemployed. And so recently we've had introduced the injectables that will last for extended periods of time, some of them initially for a month, some of them now for 2 or 3 months, where somebody can take a single shot and that will calm and quiet the symptoms for people so that they can move about their business and go about their lives without having to be responsible for keeping track of pills and taking those pills on a daily basis. When you couple that with peer support and couple that with employment support and housing assistance and family supports for families who are dealing with these kinds of conditions with loved ones, you have the recipe for recovery around schizophrenia, not a cure. We understand that. We don't have cures yet available to us, but we've got really good and appropriate treatments if we just get them to people at the earliest possible stages.
When you're talking about these treatments and some of these pills not being as practical for certain types of patients, even these injectables, adherence is still an issue, is it not?
Well, depending on the perspective that you take. I mean, from a provider perspective, you're always going to worry about adherence. From a perspective of a consumer of that the individual is taking those, I think we need to recognize that no matter what the meds are that people take, we all acknowledge that adherence is sometimes not 100%. And that's not just in the area of schizophrenia, that's in the area of pretty much any condition where people are expected to take a pill every single day. Many of us do for other kinds of conditions, and we know that once in a while we forget, and that once in a while we just say, oh, I'm just too tired, I'm not going to bother with it tonight, or I'm racing off or doing something else in the morning and I don't have time. We don't want that to happen. So I think anytime we can get a longer acting option that people don't have to do every single day, we're going to improve adherence from the perspective of a provider. So I think it's well worth looking at these as possibilities. But in this case in particular, when you overlay this new revolving door that many, many people with later stage schizophrenia are in, this revolving door of occasional hospitalization, frequent incarceration, and chronic homelessness. This is a position that my son is in, for example, who is an adult living with schizophrenia these days. Then you can see the value of providing some kind of treatment options that don't involve them having to do this every single day, but may last for 30 days or 60 days or 90 days.
Now, what advice, in wrapping up, would you give to healthcare professionals when they're talking with patients so that they can better understand their condition? Well,
don't infantilize them. People with schizophrenia are, still have brains. They're still smart. They're still mature. They're still grown up. Yes, sometimes people see them at times when they're most resistant to treatment. And it becomes a challenge sometimes to reach out to somebody, just as it's a challenge to reach out to somebody who's having a stroke or having a heart attack in the moment they're having a stroke or a heart attack and denying it. So I think the most important thing people can do is to recognize the maturity of individuals who are living with this condition and really what it takes to live with a condition like this, and not to infantilize them, and make the doctor-patient relationship as team-oriented as it can possibly be. And if that involves or includes bringing in a peer, for example, a peer support specialist that are beginning to work increasingly with clinicians, that's a good thing. If it involves bringing in other people that the individual trusts and relies on, that's a good thing. But really, I think we've got to think about this as a team effort and recognize that that's what it takes, and that's what the research is telling us, that NIMH and SAMHSA have co-funded and co-supported, called RAISE. All this is telling us that it takes teams to promote recovery, but it's more than possible. And so we always need to stay optimistic and always have hope.
Direct us to a website where we can learn more about Mental Health America.
Our website is mentalhealthamerica.net, and people can come to that website and learn more about us and what we do. They can also go to a screening site that we run, mhascreening.org, which you can also link to through our website, which is a universal screening program that we offer nationwide free of charge. More than 50,000 people took the psychosis screen on that website in 2016 alone, and people are using that as a way to get to the kinds of services and supports that exist out in the world at large. Providers use it, individuals use it, family members use it, and I encourage people to go take a look at what we've got there and what we're going to be adding to it over the course of the next several months.
Well, I appreciate you talking with us today. Some great information. Thanks for coming in today.
Thank you.
Mr. Paul Gionfriddo, President and CEO of Mental Health America. And we've been discussing the very crucial need for increased awareness and dialogue between patients, caregivers, and healthcare professionals alike when it concerns schizophrenia. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download on SoundCloud. Join us on YouTube and visit our affiliates page when you visit healthprofessionalradio.com.au.